And we are back on the Zero Hour. Joining us now is Wendell Potter, who will be known to many of you. Wendell is currently a senior analyst at the Center for Public Integrity and a senior fellow on healthcare for the Center for Media and Democracy. He is serving as consumer liaison representative for the National Association of Insurance Commissioners, but he is perhaps best known as the Cigna executive head of communications there, who went public to talk about the health insurance industry and why it needs to be reformed. His book is Deadly Spin, and an insurance company insider speaks out on how corporate PR is killing healthcare and deceiving Americans. We're delighted to have him with us. Wendell, thanks for joining us.
Oh, my pleasure. Thanks for having me back.
Oh, absolutely. Now, you were on my former show, The Breakdown, and it's
Okay.
good to have you on this one. And you and I have talked in the past about the fact, first of all, that we have something in common. We both left our corporate careers. I was risk management and health insurance, benefits, workers' comp. You were health insurance, and we are we are sometimes. I don't know about you. Sometimes I feel I still have a lot of friends in the industry, but sometimes I feel like the fallen angel or something.
So do I, to tell you the truth. There's no doubt about it.
Yeah, and it takes a certain amount of courage to switch careers, especially as publicly as you did, and you've performed a great service. And in the years since you've done that, of course, the world has changed, and we've passed the Affordable Care Act. That's one of the biggest changes. We've talked about that in the past. The industry is shifting, and I wanted to talk to you about a couple things. First of all, you wrote a piece. The title was, I believe the title was Obamacare Helps Millions, but Falls Short in Many Ways. And this, because before we go into the specifics, I guess what I'll ask for your consulting help, since you're a PR professional. Um, how do we explain that Obamacare or the healthcare system itself needs fundamental transformation without buying into the mob psychology from the right that says, death panels, or it's a failure, or it shows that government doesn't work? How do we nuance our message in a simple and clear way that says the problem is not government, the problem is something very different?
I think part of the problem that we have is that those who were advocates for it, including certainly members of Congress who helped draft it, just have given up the ball game. They've not done anything really to explain how the law works, how it benefits people. So we don't really have much of a game at all when you have that kind of a situation. More than approximately $450 million has been spent demonizing the law since it was passed, and a tiny fraction that has been spent in its favor. Now, all that said, it's easier to condemn something with a phrase like death panels than it is to explain something as complicated as the as the Affordable Care Act, because it benefits us in several ways. But I think basically what needs to be done is distilling some of the most important benefits into simple language that can be repeated over and over and over again by people who support the law. But again, those who support it have to be vocal.
Yeah, and I think that, and I'm troubled sometimes by even by the binary language of support or not support. I support getting as much medical care to people as we can, and if this gets more, that's good. And the things that are impediments need to be changed. And so I struggle. I think your piece on what needs to be done, what it has accomplished, and what needs to be done is great. What I worry about is the fact that more people have health insurance, which is good, but that doesn't always translate into health care. I read the Milliman studies that come out every year with great interest, and the idea that, for example, that what was the statistic? The typical family of four, the average family of four, with employer provided good health insurance, still pays more than $9,000 a year out of pocket, which is a lot for the average American family. So if you've got an Obamacare plan, for example, since they've embraced that word, I will too. Since if you've got an Obamacare plan, you're still paying a fortune out of pocket. So isn't part of the problem that those costs are hurting Americans, but it's not Obamacare that's doing it. It's the way the plans themselves are designed.
Well, exactly right, and of course, Obamacare was the way it was developed was to keep the private insurance industry in place. That seemed to be what people preferred, and quite frankly, the insurance industry is so powerful that there was no way to create transformation without involving them in a way that all took shape. But you're right. Long before Obamacare was passed, the industry was moving toward what was referred to as consumer-directed plans, which, in my view, is a euphemism for high-deductible plans. And more and
Right.
more and more of us are in those kinds of plans, and increasing the numbers of us simply can't afford to meet our deductibles. The median household income in this country is still just slightly more than 50,000. It hasn't budged a lot in several years. And when you have an obligation to pay $10,000 out of your own pocket when you get sick, even if you have insurance, you're just you may wind up in bankruptcy court, or to avoid those medical bills, you may just avoid going to get the care you need, which is what a lot of people are doing, unfortunately.
Right, and there have been studies, I'm sure you know, from the OECD of developed countries that show us ranking very poorly when it comes to questions like, have you uh, chosen not to receive needed medical care for financial reasons in the last year? Which is exactly
Yeah.
speaking to your point that people, even with health insurance, sometimes can't afford medical care. So the problem that we get in is if the argument gets polarized around is Obamacare good or bad, we're taking it seems to me like you're the communications professional here. It seems to me that we're taking our eye off the real ball, which is how can we make medical care more affordable for American families? This was a step in the right direction. How can we do more given that the present situation is unsustainable?
You're so right, and I think with our eye has not been on the ball, the correct ball, for quite some time, and it probably cannot be until after at least the midterms. This has become such a politicized issue that real debate, real grown-up debate, has not even been possible. I believe, though, after the midterms, that we'll see that this as a political issue will diminish even more. And we're seeing that as we get
Mm.
close to the midterms, that it doesn't pack quite the power as it used to for those who are running against the law. So I see that we will get to a day when we may be able to talk about what we need to talk about, but we just simply have not been able to do it because of the political nature of everything that surrounds the law.
We're talking with Wendell Potter, political or rather, healthcare activist and former healthcare executive. I have to confess, Wendell, that first of all, I was on interviewed by Neil Cavuto. I was in your chair, and he said, gut feeling. What do you think? Do you think healthcare will be a big issue in 2016? And I said no. And I think you're probably right to say that it will fade after the November elections. But I have to confess to a certain ambivalence when I hear that. On the one hand, I'm glad that the issue hasn't gotten more traction for the far right and for the Republicans, if those two terms are distinguishable nowadays. And secondly, I guess I feel a certain sense of regret because we had a moment and we still have a situation that is very difficult for so many people. And I would like to be an advocate for them, just speaking personally. And I don't know how to do that if this discussion disappears off the radar.
I think it will disappear off the radar for a variety of reasons. Well, not disappear, but will diminish. For one, the mainstream media is losing interest in covering it, and there's been less coverage over the last several months and few years, in fact, than there was certainly during the debate on reform. So you're seeing a diminished interest by the media. And about the only coverage we've been getting has been the he said she said kind of coverage anyway. That's one thing, and the other is I think that people have healthcare reform fatigue, and there are so many other issues that are out there that people are concerned about that it just doesn't rise to the top as it once did. I think that we will see, though, that at the state level, and not that actually might be good going forward because the reform that I see occurring in the future, in the near future, will be at the state level, and it will be a few years, I think, before lawmakers at the federal level take up this in a significant way. But I think that a lot of the states will be looking at this. Some will be trying to move much beyond what the Affordable Care Act does. States like Vermont, which, for example, which is on the path toward creating a state-based single-payer system.
Well, I think that's a great point, and it makes me feel a little better. The idea of that state-based initiatives may not be dead. On the other hand, I do feel, I guess this is my operational side from my own healthcare days. I do feel that the ideal would be one where you could leverage the size and scope and efficiencies of the Medicare Medicaid system and use that to get the best possible results because that's what a sensible publicly financed and administered health insurance program would do. But if we can't, my ideal scenario, I think I recommended this once, is that states be allowed to negotiate with Medicare, for example, to use its agreements and rates and administrative uh, infrastructure in order to run their plans. But that may not be possible. I worry that a small state like Vermont may not be able to really effectively compete. You have any thoughts on that?
Well, Vermont might be able to pull it off, but it would require the cooperation of businesses in the state, and that's not a given by any means at this point. I do think what you're suggesting would be a much better way to go, but we probably can't get there until
Yeah.
the entrenched special interests are mollified or their influence is reduced. And my next book, by the way, will be taking a look at the adverse effects of big money on public policy and politics, how it affects our daily lives, and certainly it does in the healthcare our health insurance and the healthcare that we receive. The big special interests are able to devote so much money to influence votes and at both the state and federal levels, and candidates at both state and federal levels, that a lot of the things that really make sense just don't happen because the special interests really rule.
Well, and that gets us to a topic I'd love to discuss after we go to a quick break, which is the fact that some of the big corporations, however they may be acting in the political sphere, also, of course, have financial interests in a well-run medical system for their own reasons, and some of them are taking that situation into their own hands in a new way. And you've written about that, so I want to talk about that after we go to break. We're talking with Wendell Potter, healthcare activist, former healthcare executive, and author. And we will be right back after this. I am Richard RJ Eskow, and this is The Zero Hour. And we are back on The Zero Hour with healthcare analyst and activist and writer Wendell Potter. And Wendell, you began your career as a reporter, didn't you?
I was a reporter for several years, starting out in Tennessee and Nashville and Memphis, and then winding up in Washington before moving on to the public relations world.
Well, we all began by earning an honest living, I think. And so I'm sure we could talk about the state of journalism too, and you alluded to that in our first segment. But I wanted to turn instead because there are interesting things going on in this former industry of ours, including some initiatives to take insurance companies out of healthcare and perhaps some transformations among health insurers themselves. But let's start with what you had to say about the Boeing experiment. Large employers have self-insured for healthcare before, but and in other words, taken on the costs of their own healthcare. But what is Boeing doing that is different?
Well, Boeing has a very big presence in the Pacific Northwest, and Seattle in particular. And what they're doing is they've decided, as a big company, as a big employer, with 20,000 plus employees and dependents in the area, they don't really need to have the insurance company as the middleman to broker deals with healthcare providers in the area. So what they're doing is they're contracting directly with developing and making and developing relationships with healthcare providers, working with two other very large hospital systems in the Seattle area. And the idea is that when you take out the middleman, you can reduce a lot of the administrative cost of providing health care. And certainly, a lot of the administrative functions need to continue. Somebody has to be responsible for paying claims or coordinating benefits. But you don't really need to have a big insurance company to do that, and you can reduce a lot of expenses by removing that middle layer. At least that's what the idea is, and I think it's going to bear. It's certainly it's something I think will bear watching and can very possibly succeed. If it does, I think that we'll see it replicated all over the country.
Well, and now we've had situations in the past. Yeah, I used to myself do what we called provider contracting. That was our term for it, as you know, and sometimes on behalf of employers. But typically, it would either take either an employer with huge clout in a specific region, like Boeing, perfect example, or a coalition of employers. And I suppose the possibility here is that if Boeing succeeds at this and taking it to a new level, coalitions might also look at it. But they're not just looking at rates, are they?
No, it's not just the money. It is about how care can be improved, how the delivery of care can be improved. And one of the things that the Affordable Care Act does that is not so well understood is it does force some changes in healthcare delivery and forces healthcare providers and insurance companies if they're to work with to work more cooperatively to improve care. It changes how providers are compensated, and as a consequence, more and more so-called accountable care organizations are being formed, in which there is greater collaboration among parties that in the past have been looking out solely after their own self-interest rather than for the interest of the patient. In these new arrangements, it starts with a real focus on the patient. How can patients or those who are enrolled in a given health plan, how can they be kept healthy? How can the providers work cooperatively to keep them from getting sick in the first place? This not only will help to improve quality of care theoretically and hopefully in practice, but that in and of itself will bring costs down too.
Well, people don't realize this necessarily, but when I began in the HMO world, and I was a financial analyst, and I designed computer systems, and we're talking many years ago now. Um, the HMO world was idealistic. There were a lot of
Yeah.
social progressives in there. There was the concept of the social HMO that would do exactly that, where you'd be concerned about keeping people well. I mean, HMO stands for Health Maintenance Organization. The idea would be create a financial incentive on everybody's part to keep patients healthy and happy, rather than just treating disease or making money off maximizing treatment. What you're saying, I think, if I understand correctly, is that the Affordable Care Act has given new life to these initiatives, but that it may take the clout of purchasers like Boeing to make that a reality.
I think so, but there are also indications that it can work in other settings as well too. Just last month, Anthem Blue Cross in California announced a partnership with seven of the Los Angeles area's largest hospital systems, and what they're creating is essentially an HMO that is very much like the Kaiser plan. More of an integrated plan, except that they're not all owned by the same entity. They remain independent, but they will be structuring themselves in ways that sort of mimics the Kaiser HMO model of years past that has provided high levels of quality care. So that bears watching as well too. I think that if that succeeds, we'll see that being replicated in other parts of the country too. So I do think that we will see Back to the Future to a certain extent. We'll see more hospitals having their own HMOs once again. The first hospital I worked for many years ago had a fledgling HMO. They kind of went the way of they vanished because a lot of them just weren't able to succeed financially, and others were bought up. But we're seeing that happening again. So a lot of things are changing that will, I hope, get us back to a system in which there is more attention being paid on the patient and the quality of care, not so much on the bottom line.
And where do you see this all going, Wendell Potter? In about a minute or so we have left, if you had to, I'm setting you up. I'm terrible, but in 30 or 40 seconds, tell us what the health care system will look like in 5 or 10 years. What would your guess be?
My guess is that we'll see a lot of the big for-profit insurance companies moving on to do other things. I think that we'll see more hospitals getting back into the business of paying for care as well as providing it. So I think you're going to see a blending of the lines and a blurring of the lines. It's going to be quite different in 5 years than what it is now.
Now, I guess we have time. One last question. Now, Kaiser, one of the preeminent qualities of the Kaiser system was that the doctors were employees. You see any chance of that being a bigger part of our system?
I do. I think we'll see more of that. In fact, more and more doctors are becoming employees of hospital systems, and more of those hospitals, like the integrated systems in Seattle, I think are going to be taking that same approach. So I think we'll see more of that, and it will give doctors, in many cases, more financial security, and they'll be able to practice more as they are trained to, rather than having to deal with insurance companies as so many have had to do
And
for years now.
and it's a headache for them. We know that, and they want to,
Yeah.
doctors who want to practice medicine should practice medicine. So thank you so much for joining us and for this update. We've been talking with Wendell Potter, healthcare activist, writer, and former healthcare executive. Wendell, as always, thanks for joining us.
Thank you, RJ. My pleasure.
We will be right back after this. I'm Richard RJ Eskow, and this is the Zero Hour.